the more of the stuff you have ahead of time, just like the better set up you are and prepared for everything. And make a little station, near your bed or on the couch or wherever you're going to hang out, and have all of this stuff ready.
Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita, we've got Dr. Amalfi here, and we have a brand new series for you guys. We're going to be talking about how to prepare and specifically what to buy for procedures that you're going to be having. And our first episode to start off the series is about breast surgeries. So we're going to talk about all the things that you should buy, have in your house to prepare so that you could heal the best and not really have to worry about all those, little details afterwards. So Dr. Amalfi, Ashley.
Hey,
hi.
Hey, I love a shopping list, so this is great. And
yeah, it's a shopping list.
I love being over prepared, and I think a lot of our patients do too, because when you're recovering, you don't want to have to grab anything last minute. So
yes.
We're going to run down some basics. I mean, I think the first thing is kind of as far as pain meds go, you want to make sure you're filling all your prescriptions ahead of time. So you're not sitting at CVS on the ride home from surgery. So you want your prescriptions ready to go. But I think a lot of people forget about all the other pain medicines that are helpful too, like Tylenol, having just ibuprofen. Sometimes you'll go to look at the bottle and there'll be 2 left, and that's not the time to run out, so I think some of the basic stuff, sometimes even Benadryl if things are itchy to help you sleep, just those simple basic home remedies. Make sure you have a new box and it's right there ready to go. So I think that's super simple. What other ones do you have?
And I think also the same, with medications, stool softeners.
Yeah,
so,
pooping.
I mean, yeah. So guys, listen, a lot of the narcotics, the pain medications that you get will make you constipated. And
yes,
I feel 8 times out of 10, the most uncomfortable part about the recovery is just not being able to go to the bathroom. So
pooping.
Just having
it's important.
Pooping. It's important.
Yeah.
So
and have lots of options, because
yes.
not everything works for everyone. Not everything's comfortable for everyone. So stool softeners, a little bit of stronger
juice.
laxatives. Yeah, you're never going to waste it. It's good stuff to just have on hand anyways. But, Miralax every day, Colace every day. And then some stronger stuff just in case you do get really backed up so you're not having to make a trip. I like magnesium citrate or milk of magnesia. And those are things that you could just keep in your medicine cabinet at home.
Exactly.
But definitely grab them ahead.
Yeah.
And then how about other stuff? More of the breast specific stuff?
Yeah. So I would say, for breast, most times after surgery, especially the first month or 6 weeks, you can't really wear underwire bras,
right?
Push-up bras, things along those lines. Most of our incisions are in the crease, so we want to avoid all of that irritation. So I usually tell people to stock up on sports bras and just the cheap ones, because they're temporary. Your breast size is going to change. They're going to get sort of gross, so just something
keep
that's
the tags
soft.
too, because you're not going to know what is comfortable until after surgery. So keep the tags on them. Maybe buy a couple sizes, and then after a week or so after surgery, you can try them on and see what you like, and then return whatever you don't like.
Return the rest.
But it's nicer to just have a size or two and a couple of options at home, so you don't have to drive to Target. And if not, just buy them online.
Absolutely. Amazon.
Amazon has great ones. Target, easy stuff with quick little apps so you can deliver them.
And different styles too, right? Try different sizes and have different styles. Sometimes, some of them have little zipper in the front.
Yes.
You just want it to be supportive. Yeah, front closure,
I think
so you're
front
not trying to
closure is really helpful. Yep.
Yes, I agree.
I think that's
and then
really
when you
good.
do try them on, you do want to make sure that they feel comfortable, but that none of the seams or elastic or anything are rubbing on your incisions.
Yes. And another good tip is when you buy them, once you find one you like, wash it before you wear it, because sometimes those things they have harsh chemicals in them, and I've had a lot of patients who get full rashes from wearing a new bra without washing it. So once you find one and you try it on for a bit and it's comfortable, throw it in the wash once before you wear it is a nice little trick.
Yes, no, I love that.
Ice packs are great. I let patients ice very quickly because you don't have great sensation. So heat and cold, you just want to be careful with. But I do think ice packs are helpful. So you want something that's like broad and is like very moldable. So maybe even frozen peas.
I agree. And then I think also just some like loose t-shirts, tank tops, things along those lines.
Like a hoodie. A hoodie is a great thing to wear for breast surgery because you don't have to put it over your head. So you can just wear a hoodie with nothing under it but your sports bra, and then you put your arms in. Anything that zips in the front or buttons in the front and is just a little bit loose is probably going to feel best.
Right.
Even like your husband or boyfriend's like button down because it's oversized and it clips in the front. Like those are really comfy to wear to surgery and then also that first week.
Yes, absolutely. And then I think there's, sleep is a big thing, right?
Yeah, let's talk about some sleep help.
Let's talk about sleep help because after breast surgery, you can't sleep on your stomach. You can't really sleep on your side initially just because of the positioning of your arms. So you have to be a back sleeper. And I usually tell my patients to sleep on like 2 or 3 pillows. So you're a little elevated, especially in those first days after surgery to help with swelling.
I like a body pillow or a pregnancy pillow. So
the boppy pillows, right?
Yeah, it's like an adult boppy. That's great. Where it like kind of goes around you like a candy cane or a rainbow, and you sit in there. It keeps you kind of like wedged in there, so you can't roll onto your breasts, and they're comfortable as heck. I still sleep with one. I had one from pregnancy, and I love it so much. I sleep with it, and my kids ask for them too. So we have a lot of pregnancy pillows in my house, even though no one's pregnant. We love them. So it is a pretty comfy way to sleep, and it's really helpful post-op.
It's very helpful. So yeah, just check your pillows, make sure that you are, that's all set because that's the last thing you want to worry about after, sleepless nights and all of that. So,
and then scar cream, you don't have to buy scar cream right away because you're not using it for a few weeks, but it's not a bad thing to have. Ask your doc if there's one that they sell and recommend. We always like things that have silicone and SPF in them. Those are kind of the important ingredients. But it's nice to have those ahead of time, but also something that you can get from your surgeon and or order quickly if you need them or you need a refill. But that's like really forward thinking. I can't think of anything else. Can you?
I think the only thing that I would say is sometimes after surgery, you don't really have much of an appetite. So having protein shakes, just something on hand. Because after surgery, you want a high protein diet, low salt. Obviously, you don't want a lot of processed sugars and things along those lines. So just having your favorite protein shake available, just in case you don't feel like eating, is going to be good for your overall recovery.
Love it.
I think
protein
that's
shakes,
right?
Protein bars. It's awesome. It's great.
Yeah,
you guys are going to
bars.
do great. Don't stress. If you get nothing, you'll still be fine. But the more of the stuff you have ahead of time, just like the better set up you are and prepared for everything. And make a little station, near your bed or on the couch or wherever you're going to hang out, and have all of this stuff ready, and a phone charger and a channel changer, and you're set.
Pick out your Netflix.
Yeah, you're great.
Shows to watch,
It's
and
awesome.
you're all set.
All right, we're going to talk about some more procedures and some like more specific kind of great little pearls and tips. So we will see you guys for our next What to Buy episode. See you, Smith.
See you guys.